The issue at the Geriatric Hospital, it speaks more to environmental issues within the facilities and poor management of the facilities. You have a situation where nurses are being intimidated to work on the wards with infected patients, even though these nurses spoke out against it. You have a situation where infected patients were moved to wards with persons who were not infected, and this has resulted in the spread of the infection. The chief medical officer reported only 9 cases, but from the information which I shared earlier on the number of wards, there are over 24 cases in the patient population and more than 7 nurses who have been infected with scabies since the outbreak. We also know that the matter was raised since January 2025. Now, scabies is one of those infections which requires contact tracing. And as long as you have an infected person with scabies, the correct procedure, which should be followed by the infection control nurse or even persons from the environmental health department, would be to go through the procedures to do the contact tracing to find patient 0. It is highly unlikely that the patients within the geriatric hospital brought it in unless it was brought in by a new patient. It could have been brought in by a staff member who was already infected, or it could have been brought in by a visitor, but it's important that you identify and do the contact tracing. Scabies is highly contagious, and if we do not deal with this matter in this issue in a timely manner, you can eventually see this infection spreading in the schools, because the nurses and the staff at the hospital, when they leave work, they go home to their families. And if they are infected, they can infect their families. And if the families are infected, they can infect the schools and the workplace that they go to. And you have the crop over season coming up, a season where we are in high contact with each other. We would not want to have an outbreak of scabies. Don't want to run the country into fear, because it is a highly treatable disease, but it needs to be properly managed. You need to do the contact tracing, and this is not the time for the government and the Ministry of Health to act as though it is in denial and not share with Barbadians the appropriate facts. And that is why I again urge Barbadians who have patients within the geriatric hospital, it is your right to call, as they're not allowing visitors, but to call to make sure that your family members are being properly taken care of. I cannot imagine the torture that these persons are going through, because scabies is it causes intense itching of the skin, and you break out into lesions. Cannot imagine the torture that they're going through. It's a trickle-down effect of poor management. Now, you have a ward to manage or a hospital to manage. If you are not getting the resources to buy the adequate supplies, you're going to try to manage it the best way that you can. That is the situation that we have fallen into at the geriatric hospital. And as a result of that, you have management making poor decision choices to make up for the shortcomings. You're on the staff, you don't have the PPE equipment, you have a laundry facility that is not working, you have not done the contact tracing, which should have been done since early January and prevented the spread. You also place infected patients on ward with persons who were not infected, and because of the close proximity of the patients in the wards, it is highly likely that the infection will spread, given the nature of how scabies is spread. So yes, someone needs to be held accountable, but in this situation, I believe it is the Minister of Education and the lack of proper funding and resources. The Minister of Health, and the lack of proper funding and resources being given to run the various departments. And that problem with funding is not unique to the geriatric hospital, but the psychiatric hospital is facing similar staff shortages and similar lack of resources. Same thing in the Queen Elizabeth Hospital, same issue in the polyclinic. So that is why our healthcare system is in crisis.